So I would say that the Montgomery structured argument for her research question is that research on mental health of refugees suggests that they have a higher rate of major depression and PTSD. The excess of mental health problems may be due to some of the traumatic personal experiences refugees have. Refugees receive additional health care for mental health issues, unlike other immigrants. The immigrant paradox suggests that immigrants are generally healthier, including mental health, than US born, but some immigrants who are not refugees may also experience the traumatic events that refugees experience, and this may be associated with higher rates of depression. Non-refugee immigrants do not receive the same mental health screenings and care as refugees, but no studies have evaluated the association between pre-immigration persecution and mental health in a general immigrant population. In other words, not just among a refugee immigrant population. So the new immigrant survey data, which is publicly available data that Montgomery used, was used to assess the association between pre-immigration persecution and depression among a sample of immigrants to the United States receiving permanent resident status and whether visa status, meaning refugee versus other type of immigrant, modified that association. So when you're considering your research question, you might think about framing it within a theoretical framework. Some commonly used examples of theoretical frameworks for health and health outcomes and behaviors include the health belief framework, which suggests that health behavior is determined by perceived susceptibility and severity, perceived benefits and barriers, cues to action, and self-efficacy to implement that health behavior. There is also the social ecological framework, which suggests that factors at multiple levels of influence, from the individual to the interpersonal to the organizational, community, and public policy level, can influence behaviors, and this behavior in turn influences the social environment. And then there's also the minority stress theory, which suggests that being a member of a minority group can increase stress, especially in societies where there is antagonism towards certain minorities, and that stress can impact health behaviors. So if you have a theoretical framework in mind, it can help you organize your literature review and summary. It can help you identify aspects of the framework that have not been addressed or assessed in the literature, in other words, a gap in the literature. It can help you generate testable hypotheses, and it can also help you determine appropriate methods, in other words, variables and measures that you need to include in your modeling in order to best test the hypotheses that you have. You may model your specific hypotheses, using diagrams, perhaps nested within a theoretical framework. So in epidemiology, we often use DAGs to help us model our causal thinking, and DAGs can help you better explain your hypotheses, how the different variables are interrelated. It can help you better understand what variables or measures you need to include in your modeling in order to test your hypotheses. And it can help you decide what to assess as potential confounders, mediators, or effect modifiers in your analysis. DAGs can be either really complicated, as the example on your left-hand side, or simpler, as is the example on your right-hand side. And you can create a DAG just using PowerPoint slides, where you put in the text boxes and so on. Or you can use Daggity, which is a software specifically used for creating a DAG, and the website is posted here. I would suggest that you start thinking about your research questions. Think about how you can justify your research question based on whatever literature you've reviewed so far, or just your understanding of relationships among different variables that you're going to include. This is just to kind of keep you progressing through the thought process towards your ultimate research paper and project.
I'm going to take the mic back from Dr. Kelvin now. This is Madeline again. So like Dr. Kelvin said, if you have not already done so, start narrowing down from the research topic that you're interested in exploring through Project 2 to a specific research question that you'd like to address. Start the literature review, and by that I mean go explore PubMed, etc. for articles related to the topic that you're interested in and make a table. Take notes on their methods, results, findings, and other important information from those papers. This is a really good time right now to be starting your literature review and thinking about how you can justify your research question. This will set you up really well for the first peer review session that's in the beginning of March, and you can check the syllabus for details. This is just an overview of what we covered in these Week 4 lectures. We discussed the purpose of a literature review. Dr. Kelvin described the process by which you'll conduct the lit review, as well as tools that you can use like citation software, the amazingness that is, and the tables that you can make in either Word or in Excel to organize the information from papers you read. Dr. Kelvin also explained how to structure the introduction/lit review section in your research paper for Project 2 by talking you through those 2 examples from Levasseur and the Montgomery papers. So that's all the lecture material for Week 4. We'll talk to you all soon.